Welcome. Thanks for joining us today. This is still kind of a little bit of a new concept thing, but everybody who has participated in them has really had a good time with it. It's just like I started thinking that it's kind of like The View, except related to issues about older adults rather than whatever they talk about on The View, so it's just kind of like people sitting around a kitchen table. I'm gonna turn my sound off because I don't want, or down because I don't want that.
Okay. I'm not sure if any of my coworkers are joining me, but they might be.
I will watch for the notification.
Okay.
So you guys know me. I don't need to say anything about me, but of course this is Community Partnership on Aging. And then I will give you guys each a chance to give a little 2-minute elevator, 2 to 3 minute elevator speech about your business or any programs that you're promoting right now. So why don't we start with Shalom?
I think we should start with Shannon, ladies first.
Okay, let's start with Shannon.
Okay, perfect. Well, my name is Shannon Reglus and I work for Physicians Association. So I always ask folks when I talk with them, who loves to sit in the waiting room at the doctor's office? And nobody ever raises their hand. So Visiting Physicians Association is a primary care physician house calls group. And we've been around for about 28 years. And we offer full spectrum primary care services to patients wherever they call home. So in addition to having a physician or a nurse practitioner manage your primary care, we also can help our patients in the home with lab, diagnostic testing, x-ray services. Of course, basically anything a primary care physician's office can do. We do that for our patients at home, help to link them with community resources. We are available to our patients 24 hours a day, 7 days a week. So on those off hours, if something's going on medically, we do have, all they do is call the office and we'll get them linked with a provider to help them. And yeah, so I think one important thing to mention is that our patients do not have to be homebound to use our services. A lot of folks have issues with transportation in regards to keeping doctor's appointments. So our goal is really just to help our patients stay as safe and healthy as possible at home. And of course, we do make a lot of referrals out to our community partners to help get services in the home. The only place we cannot see a patient is in a skilled nursing facility or a hospital. So independent home, private homes, independent living, assisted living, group homes, we can service patients in any of those settings.
Did you see an uptick in requests for services over COVID?
Absolutely.
I guess it's probably obvious, but
yeah, absolutely. I think a lot of people were and are still scared to go out, and sit in a waiting room or just be out in public in a group of people. And I think people just kind of find that it's not only for the patient, it's more relaxing. It's not, they don't get as nervous because the waiting room is their living room,
Yeah.
And for our caregivers, it's really nice because a lot of our caregivers are still working and they don't have to take a whole day off work to get their loved one to the doctor. And we do see patients 18 and older. So as long as they're over 18, we bill insurance the same way as a doctor's office would. So as long as they're over 18, have an insurance plan that covers our services, we can service them right at home. But yeah, you're definitely a lot more folks, I think, bringing care into the home than before COVID, for sure.
Yeah. Good. Thank you.
Thank you.
All right, Sara.
Okay. My name's Sara, and I'm a research associate at Case Western Reserve University. And we are doing a study about the genetics of memory loss. So we are talking to people about memory loss, brain health, healthy lifestyle, that kind of thing. And we're also looking for people to participate in the study. You don't have to have memory loss to participate. Our qualifications are you should be 60 or over and be African American, or any age, any race and ethnicity, and have early onset Alzheimer's disease, which is you were diagnosed before the age of 60, or be part of a family with Alzheimer's disease or memory loss. So that would be 2 or more people living with memory loss, and then a third person to act as like caregiver or control person. And they can be any race or ethnicity, families can. So we're just going out around the community, doing some outreach, doing some education, and looking for people to participate in the study.
You know what, Sarah, I feel like I've known you a really long time.
Yeah.
And it just is now dawning on me, is there an end? Like, what's your, you know?
Yeah. So we actually, the end is not in sight. So we actually just got a new grant. So we work with University of Miami in Florida, as well as Wake Forest and Columbia, and then Case Western. We're all partner and collaborating together. And we just got a new huge grant. And we are gonna continue to see people using the same qualifications for probably several more years, just trying to get as many people as we can.
That's
so
great.
We're all the sites do the interviews, the participation, and then Miami does the genome sequencing. So we draw blood and look at the DNA.
Okay.
So, yeah.
And did you have a good time at the Older Americans Month event?
It was
I
great.
mean, everybody said that it was so nice, you know.
Yeah.
So I was glad, you know. It was telling people that it's kind of funny, you know, like that hour before, at like, because it started at 3, so at like 2 o'clock, you know, when we were all ready and there was nothing to do, everything was set up, and I'm sitting there thinking, you know, maybe people won't come, you know, because
no,
I don't know, you know, I mean, that could totally happen. And then all of a sudden people just started coming, and it was just busy the whole night long.
Yeah.
It was really great.
People were there for, you know, the whole night, and it was busy the whole time. People kept coming and coming, and yeah, everything I heard was really positive.
Good. All right, thank you. And so last but not least, of course, Shalom.
Hello, my friends. Thank you for inviting us. So I'm Shalom. I'm from Right at Home, and we're the hands-on home care that is private duty wherever our clients call home. So we basically are a franchise, and I'm the owner of the East Side offices in Highland Heights and Beechwood. And we help dozens of people a day in our neighborhoods by matching them up with caregivers that are offering the right care. So in general, it's specific to our clients. We make a personalized care plan. Our goal is their goal. So if they want to live at home, if they want to, you know, I don't know, make cookies. So we're here to help, you know, bake and measure. You know, we're along for the ride. That usually it's the kids oftentimes who call us. In general, we want to help our seniors to stay as independent as possible. So sometimes we just come for a few hours. Sometimes it's around the clock, it's 24 hours. I would say that the things we get asked to do the most would be like cooking and cleaning in the house, everything from, you know, laundry and walking the dog and sorting the mail. Also, we're allowed to drive, so we can take our clients wherever they want to go, including to their local senior centers. Yeah, we do pretty much whatever's on their list. Our clients are all 18 and older. They're all adults. Occasionally we have grants, but oftentimes it's paid out of pocket or perhaps by the VA or one of the groups that we partner with, sometimes like dementia, Alzheimer's, MS, that sort of thing. Overall, we're pretty affordable. We can be reached around the clock. So we have someone always available to talk to, a live person, someone on my team. And the caregivers are also on teams. So we try to have the same caregiver with the same client regularly. Basically, routine is our friend, so kind of doing the same tasks, but they are on teams. And all of the caregivers are my employees. So they work for our family, for our franchise. So we're in charge of everything you would expect. So we run the background checks, we pull their references, we pull their driving records with their permission, random drug screening, we do ongoing training, ongoing testing, ongoing supervision, help them to get the clients, the neighborhoods, the diagnoses they need, match them up. Who loves cats? Who likes dogs? You know, everybody has their personalities. Like I had a client hire me today who said, you know what, Dad's very private. You know, he's going to need some time. And also, this is all new for him since Mom passed. Do you have a caregiver who is not a chatty Cathy? I'm like, of course. I have more than 100 caregivers. We will find someone who, you know, we think is a good connection. We're pretty good at making a good match. And if not, so we'll bring a different caregiver. Or, you know,
Nice.
I don't have a contract. I don't have a minimum. We just want to be there to support the clients as they age in place, hopefully, you know, with grace and dignity.
Nice.
So it's been rewarding.
Right.
We started it. Mom and Dad graduated from Heights High. Then they moved from Cleveland Heights actually to Shaker. So my wife grew up here in Shaker. Now our kids are in school in Beechwood, and I don't know. We're part of the neighborhood. We're very active in the community. So
Nice.
it's been rewarding for us. So,
Well, we
yeah, we like giving back.
We appreciate your support too.
Absolutely.
Okay, so on to our topic, which is a little bit of an awkward topic to say, but what is the best advice you have either given or received or heard related to how somebody should know that it's the best time to move, to actually make that decision? I don't know the answer to that. So if anybody, what's the best way to help somebody navigate that sort of first step?
Do you mean
what I would say is
assisted living or
whatever wherever the move may need to be, you know,
Right,
you know,
okay.
you're at home and, you know, you're thinking, the kids are maybe thinking, this is getting to be too much for mom and or dad, you know, but mom of course wants to stay home. You know, how do you know when it's really time to actually make that move?
So just from myself and perhaps from visiting physicians as well, our goal is to help our clients to not have to make that choice. We want to be able to offer them the support they need. If they choose to, if that's part of their goal, like maybe they want to be closer to their children or grandchildren or something like that, I want them to be able to do it because they want to, but not because they have to. And I see oftentimes a decline when my clients move, sometimes a significant cognitive decline because they're pulled out of something, of an environment that's familiar, you know, surrounded by the, you know, collections of a lifetime, but the, you know, with all of their same, you know, pets and furniture and friends in church. And I like them to be right in their community.
But there not has to be, but oftentimes there is, you know, what is it, you know, just that safety is compromised? Is it, you know? Yeah,
it's usually, exactly. So like for my clients, if they just don't feel safe at home anymore, so then that's probably the time to be thinking about, well, what could we do to increase safety? I mean, sometimes it's something as simple as maybe getting like an emergency alert bracelet or a stair lift, or sometimes modifying the house a little bit just to make it more, I don't know, on one level or something. But sometimes it really just depends. We have folks in the community who, I'm one of them, but who will go out to do like a free assessment and come out, see the situation, and just, you know, look around and make suggestions. I work really well with my partners and competitors, and we have some wonderful assisted living and memory care, and also, you know, places that are for not just short-term rehab, but also sometimes, you know, long-term care. So we're blessed. We have fine hospital systems and doctors. So we're kind of like in the oasis of healthcare in Ohio, that we have lots of choices, and there's more choices coming.
Sure.
But like I had a client just
Shalom,
yesterday.
let me ask Sarah and Shannon if they have some thoughts on that too.
Oh, Shannon, you're muted.
Sorry. I can share a personal story about this. So my mother, I miss her dearly. She passed away last year, but my mother was very independent, always did, always worked really hard, always was on top of everything. She took care of my father before he passed. And she got sick late 2020. And we kind of watched this progression of a healthy woman who was very active, who always took care of her business, who took care of her kids, who took care of her grandkids, kind of start to make this decline health-wise. And so, I'm the oldest. And then I have a younger brother and a younger sister. And, we had to get together and I had to educate my siblings like, okay, I'm a nurse. I know about this disease process. It doesn't get better, right? It progresses. And so we have to sit down and think of a plan. Now, my mother, of course, like many, very stubborn. I'm not leaving my house. I don't care what you do. You'll have to drag me out of here. So I already knew what we were going to be dealing with, but in the back of my mind, I also knew that there would come a time where we would have to move her from home. So I actually moved in with her. When she came from the rehab facility and out of the hospital, she needed total care. So I depended on a lot of my friends that in the industry that I've worked with, home care, private duty, and then eventually hospice. And we kept mom home for as long as we could. But there did come a point where we had to find, a higher level of care for her. Luckily, she was seeing a physician that, could come into the home. And we were able to find a great little place really close to her house where the physician was able to follow her. But all along, she was like, no, I'm not going. If you make me move, I'm not talking to you anymore. And no matter how much you try to tell your loved one, like, this is what's best for you, you're not going to change their mind. And so my advice would be, as much as you can get them involved in the process, the more the better, because there's this old fashioned stigma about higher levels of care. And like, my grandma's 100. Nursing homes back in her day, probably weren't the best. Assisted livings didn't even exist. So getting them involved in the process of making the decisions, taking them for tours, allowing them to ask questions, allowing them to dictate what they're going to bring and how they want their apartment set up, or, what neighborhood they want to live in, or, things like that. I think that would be my best advice, is to allow them to make as many decisions as possible, even though you're kind of, in charge in the back, getting things done. So, before we placed her, we were able to get her involved in the decision, and it was less, I think, less traumatic for her when she did have to make the move, because she had planned it. She had made the choices. So that would be my story.
One thing I tell my mom a lot is, like, she will not use a cane. She's not the most stable. She's a little wobbly, but she's okay, but she won't use a cane. And I just keep trying to tell her that these tools are meant to keep you independent, not take your independence away, so I think that's maybe something, that's key too. We want to keep you around, we don't want you to go anywhere. We're not. And I think that's a big fear for people. It's just that, they think that, it's a hard pill to swallow though, isn't it? I mean, nobody wants to get older.
Right.
No. So
I think a lot of times when people know that they are going to assisted living or something like that, they know they're not coming back to their home. And it's sort of, maybe they're thinking this is the end, even though it doesn't have to be, you know, they could live there for 20 years, but maybe just need a little bit of extra help. But I think
Yeah,
you're right,
that's a
Teresa,
good
it's
point.
difficult to think about.
Yeah, it's almost like maybe they have to go through the 5 stages of grief, you know,
Yeah.
like in dealing with it, because it's a loss of something still, you
Yeah.
know. So that's why I wonder if anybody's ever tried that before, like actually analyzing that, you know, how that could benefit, you know. We often get, as I'm sure you guys do too, we often get, you know, calls from the children who are like, you know, I really want my mom to, and, or, you know, participate. I really want my mom to. And I'm like, well, what does mom want? You know, like you can't necessarily, I know you want your mom to get involved, but getting your mom involved in something that she's not interested in getting involved with is just not going to work for anybody. You know, it's not going to be productive at all. So that's to your point, Shannon, you know, it's just that getting them involved in the process is, you know, really important. So.
And I think a side note of just like with this discussion is thinking about planning early, because we don't think about these things until we have to do this stuff, and then we're scrambling and we don't have our finances in order, and there's like a laundry list of things. So I think the one big thing that I learned from the process with my mom is I'm going to plan. So I'm going to plan for what I want as I age, because I'm still at the age where I can make those decisions. And so that when the time, if and when the time comes where I have to, you know, where I need more care, my kids know exactly what I want and what to do. So I think that's important to me.
For my parents, they had a fire in the house about, I don't know, maybe like about 2 years ago. And they're both in their young 80s. And it was very disruptive because they had to move out. They were forced to move to another house in the next neighborhood over. Well, and they had to decide, you know, do we want to sell the house that we've been in for 50 years? And they decided that they wanted to stay, age in place, and renovate, obviously with some additional support. But they added a full bathroom on the first floor just to, you know, just thinking down the road if mobility becomes more of an issue. So that was kind of their decision. But in the case of my in-laws, and we created Right at Home to support dad and mom, they basically said, we're gonna kind of see where it goes. We're not necessarily gonna plan it out as much, because he was falling and the falls were taking him to the hospital, and in the hospital he was picking up, every time he went to the hospital he picked up an infection, so it was always like to rehab. And after a while they said, you know what, and this was his decision, he said, I just don't want to be in the nursing home anymore. I want to have my food, my TV, as loud as I want, what I want, my pets, my wife, you know. And we moved him home. We put basically a hospital bed into the first floor library and created almost like a little assisted living for him right there. And we did bring in skilled home care, also private duty home care, also hospice. And that's where I remember right before he passed away, he said, where am I? I'm like, you're home, Dad. You're where you wanted to be. He's like, who owns this house? I'm like, you do, Dad. This is your house. He's like, you know, is mom okay? I'm like, yes, you took care of her. How are my girls? I'm like, well, I married one of them and they're fine. You know, you did great kids. Everybody's doing okay. And he was having like this like lucid moment in the middle of having not really spoken for like a couple of weeks. And he jumped out of bed naked, but whatever, it's his house. And he said, let me just take a look around for a minute. He took a look around and he laid back down, and that was that. I was with him at the end, but he was where he wanted to be. And the folks from his care team and from his family were right there with him. So I don't know, you know, that's what he asked for. But I have clients, and I'll also support clients. I don't care where they're at. If they're in the hospital or the nursing home or the assisted living, if they want their caregiver, who's now like part of their family, to come with them, we go wherever they want to go. As long as it's in our service area, we're going to be there with them too.
I think the planning thing is a little bit of a catch-22 too, right? Because everybody knows that you should plan, but I think planning for old age is probably the hardest thing to plan for. You know, I can plan a vacation all day long, but I don't want to plan for, I don't even want to plan for my retirement, much less for what, you know. what I
How'd you
mean?
like to meet with the elder care attorney and fill out an advance directive or a will or a, you know,
Well, and
no
that's
fun, but
what
you
I
gotta
was
do
going to
it.
say though, too, right? Yeah, that's probably one of the things that is a good place to start is as far as your planning, is your advance directives and, you know, your living will and all.
I mean, it basically tells your family and also your medical staff, this is what I want. You know, I don't want to be intubated, or yes, I want you to take every possible step to extend my life. I mean, people make different choices, you know, and you can sit down with your rabbi, your priest. I mean, you can have the conversations.
Yeah.
I think for a lot of the people that we see, the choice is almost taken away from them a little bit, because by the time that they need to move, can no longer live on their own, usually their child or spouse or someone already has their power of attorney and makes their healthcare decisions for them, and just can no longer care for them in the home. Like, and then also a lot of times becomes a safety problem. Like, you know, we see a lot of people who are in their home as long as they can be, but especially as they lose more and more memory, they just cannot safely live alone.
Yeah.
And I've seen people move in with their parents, and then I've also seen people who move in with their parents so that the parent is still at home, like has that familiar surrounding, that kind of thing, so that they can stay as long as they can, rather than the parent moving in with the child, although that happens a lot too.
Yeah. You know
We did what
Sarah,
Shannon
that
did
reminds me.
when dad was declining. I mean, I was working as a chaplain for the military. I still do that on the side. And we moved the family, you know, back from, we had an overseas posting. So always in the US military, but we moved back home and moved in with them until we could get more support. Until then we were able to move back into our house. So, I mean, and you see it up close and personal when you're living there. And then, you know, you can help to sometimes, you know, guide some of the choices. Like, this isn't working, this is working.
You know, Sarah, that reminded me of something too, which is, you know, how to reach the people who don't have family to help them planning. You know, because for whatever reason, either you never got married and have kids, which is, you know, totally going to be me, by the way. And I hate the term that they came up with for that, elder orphans.
Oh,
I never heard that.
Is that not the worst term?
Yeah.
It just sounds so sad. But, or whether it's just that your spouse passed away and now you're alone, or whether it's just that you don't have access to the resources and nobody's really talking about these things, you know, or whatever it is. But I'm sure there are plenty of people who would never even consider the fact that they need to start planning, you know?
Yeah. I don't know how to reach those people.
Mm-hmm. Well, I suppose, that's a good point. You know, I mean, it makes me sad. Like, I feel like in a way, a good way to do is just like something we could do is even just, you know, putting a little thing on our website or, you know, sharing it on social media, because you never know who, you know, who's going to see it, or, you know, anytime like our social workers, you know, like they have information, we can always have the paperwork available too, but still, it's crazy, isn't it?
Yeah.
Oh.
You always think about the children, taking care of the parents, like the sandwich generation or the spouse. But if you don't have that, or if you, like, maybe your spouse died and you don't have a big family or anyone close by, we've seen that too. Like, people will say, I didn't realize how bad you know, my mom was, or my aunt, or whoever, because we're not seeing them every day, you know, we're not seeing them that often. And then you don't visit for like a year, and then the next year you're like, oh my gosh, mom is really not doing well, or whatever.
For sure, right? Because
Hard to
everybody
catch.
maybe a little bit in denial too. The parent might
Yeah.
be a little bit in denial about how
Oh
bad
yeah,
they're
for
doing,
sure.
you know, so
Mhm.
yeah, so yeah. And you know, I mean, for sure, if they want to hide it, they know how to hide it, right? I mean, I remember probably maybe, you know, 1 or 2 years after I first started here, there was a lady that came to our lunches pretty regularly, and we never knew it until she ended up getting sick. And we had a conversation with the niece who said, oh yeah, by the way, you know, Aunt so-and-so is actually like pretty far along with dementia. She was like, what? Like never ever would have guessed at all, but she was doing things at home that, because you know that's home, right? She was like putting her used Depends in places rather than disposing of them properly. And it was like, I mean, you know, here we are seeing this, you know, person for a few hours a day that, you know, is just like a little snapshot, right? You know,
Yeah.
but when you're at home, it's a whole different story.
Maybe you were seeing her at her best when she had on, like you said, her game face.
Yeah.
For sure. Yep. Yeah. And, you know, I mean, it's like not that, you know, I think it was the case that she had never had children, and she was fortunate to have her niece that was, you know, helping her. But you know, then on the other hand, I think, and I'm sure this is probably often the case too, but the niece had her own family that, you know, she was caring for, you know, as a mom and as a parent, and, you know, work or whatever it might be too, you know, so it's not like, not anybody's fault, you know, it's just that it happens, you know, so you have to, the planning, back to Shannon's point, is planning is, you know, and getting the word out there about planning is really important too. So this way, and maybe, you know what, maybe the, you know, like Shannon said too, the planning piece of it kind of helps you to come to terms with it a little bit more.
Yeah, that's
and earlier too, you know, so
I always thought about, like, wouldn't it be cool to have an event, like a healthcare planning event, where you have the elder care attorney, you have the life insurance agent, you have the,
We
you
did
know,
that. We did that a couple times at the, well, this is before the pandemic, but we did it out of the Orange Senior Center. And they actually were able to use the school, because it's all owned by the city. They were able to use the school across the street to have a bigger space. And I wish the turnout would have been bigger. I think people just don't love the idea of having to make all these hard decisions and conversations.
yeah,
I
I
think
think
many
that's,
different
they were more
kinds
interested in, you know,
of
like, oh, here,
long-term care.
let me do the ear test. Let me do the hearing, but I don't want to talk to those insurance
Yeah.
people.
yeah, that's really true. And Sarah, what you said too, that there's so many different kinds, you know, and so like us as an agency, we always have, or like to offer options, you know, so we would want to have, you know, 3 different elder law attorneys, or, you know, practices, you know, and it's, and again too, I mean, I've had the sort of the feedback from people like, oh, why do you have that? I don't really want to, you know, think about planning my funeral. You know, I want to do fun stuff. And, you know,
You
it's
get
just,
into the hospital, though, what do they give you? They give you a paper and they say, make some choices, sign the paper, you know? So if you
Yeah.
don't have it done, you know, it's in crisis now and you're not feeling great, and now you have to make the choices. That's, yeah, planning's helpful.
yeah, but it's a good idea though, Shannon, too, you know, because, I mean, you know, because there is that just, you know, sort of thought that even if you help one person do it, then you're still helping that one person, you know, so.
I love your idea, Shannon. And like I said, I saw it done. And you know what? That senior center also, they had it kind of organized. They sort of put the tables. To Teresa's point, they did have multiple. They weren't trying to say, okay, here's one elder care attorney, one insurance, one funeral home. They basically opened it up. They had a bunch, but they did add a few extras. Like they brought in somebody to do notary, you know, to give the stamp. And they did it for free. So this was somebody from one of the local banks, and they brought their, I forget what you call the thing when you stamp it.
Yeah.
It's a good idea. I like the idea of, being able, because actually we could even call it like I mean, we'd have to think of a nice name, but like advanced directives, like,
Yeah.
because it would almost in a way force, but I don't mean force, maybe it would make people
realize I have to make that decision.
yeah. And hey, you know what? I've been putting this off for a while. Now's the time, why not? Because, here it is and they're
Yeah.
offering it, so it's not a bad idea. I'm gonna write that down.
But there are a few people, and this is pretty rare, but like I had someone hire us today and he said, you know what? I've been avoiding this. My kids kind of made me promise. I think it's like Father's Day weekend, right? So he's like, they're all coming, and this was my deadline because, and in this part, what he said, it made me a little sad. They were like, we're going to put you in a home unless you make some choices for yourself, so that was a little bit scary for him. I felt that was a little over the top, but in any event, so they had us, for example, and I make a personalized care plan for him. I don't have any contract. I'm not going to do anything unless somebody, calls us and gives us orders. We just listen to what the families, what our clients say. He has to give us permission to listen to his family if he wants us to do that. And he was like, look, these are the things that are important to me. Let me show you my collection. And he was so cute. He's like, let me show you what I can do. I was a little worried because so he gets off his walker and he got down onto the floor. He laid down flat on the floor and said, see, I can still get up. And now it took him a minute, but and it was step by step to his knees and then holding on. And then he was able, I'm like, yes, you can do it. You don't need us, but he's like, but I actually kind of do. And he's like, I'm wearing this shirt backwards and I know it. I couldn't get it on today. He's like, you know what? Am I willing to accept a little bit of help? If you make breakfast my way, yes. So
Yeah.
We'll see.
Shannon, I think were you going to say something?
Oh yeah, I was just gonna say, like, for me, I know that I want to make all these plans for my future and what's going to happen as I age. If I had a one-stop place to do all that, life is busy. People work, they don't have time to get to all appointments. I think that would be pretty cool.
Actually, you know what? You're right too, because now as the world has changed to wanting things like Amazon and Kohl's, and I'm like, what I mean? Like it's almost like now's a good time to actually do something like that because it's the ease and the convenience.
Or sometimes people know what they want, but they don't know where to start or where to find it.
Yep.
I always think about, it's not even necessarily as you age too, like I know what I want already, and so, and then like some people have chronic illness, and that can make a difference too.
Yeah. Yeah, it's got to be an easier, I think, part of it is just, it's like talking about it takes the fear away from it.
Yeah.
Too. So, wow. Well, does anybody else have anything else to add?
I love your idea of bringing some folks together and maybe putting it on like you say, the YouTube or the social media, because it is hard to know where to start the conversation or who to trust or who even does any of this in our community. So bringing that together. Thank you, Trish.
Yeah, I'll talk to our social workers and
I would love for you to get your social workers on there too, because a lot of people know them like kind of in theory, but like if you had them also, here on the screen, then they might feel a little bit more comfortable making a call, because they are a wealth of information.
Yeah. And I think back to Shannon's point, like having this event and saying, bring your children or whoever, your caregivers might be, and then you can make these decisions together. So so like everybody can get all the information.
That's a really good idea. And I would think though, too, we might want to have it in the evening or at least like after work, so.
So like the adult children could come.
Mm-hmm. Yeah, it's a good idea. I like the idea of bringing, encouraging the kids to come with. Well, Shannon, I guess we'll have to have a conversation.
I'm happy to help. It's something I need to do, so I am definitely the first person in line for that event.
Good. Yeah, for sure. Oh my gosh. So, all right. Well, I guess we can go ahead and end it here. It's about 3:40. So this is a nice conversation. And this is really all it is. It's just, kind of like talking about these things. Eventually we'll, like I said, we'll put it on our YouTube channel. Anybody can watch it once it's posted on our YouTube. And you know what? I feel like, the goal will be eventually, I'd love to be able to have more seniors participate on these with us too, because they're going to be able to give a perspective
Right.
directly in the conversation. But no matter what, and you know what, but it's not comfortable for everybody, right? To be able to talk about it on Zoom, which is fine. That's why I want to put it on YouTube, because then anybody can watch it and, get the information about it too. So actually, somebody mentioned to me, Carolyn mentioned to me last month that this might make an interesting podcast too.
Oh, yeah.
So, where we're just kind of, because that's, it's really what we're doing, just in a different format. So yeah, we'll get around to that one day, I'm sure. So anywho, so, all right. So thank you all for attending and for participating. It was a lot of fun. And I guess we'll talk to you very soon.
Thank you.
All right.
Thanks.
Okay.
Bye-bye.
Bye.